Hello, everybody. Happy, what's today? Thursday. Welcome to Nicole D. Vick Live. It is I, Nicole D. Vick. I am so excited to be here tonight with all of you. Thank you all for taking the time to be here tonight. We have a very, very important show to this evening. I know we usually are giggling and having a good time, but today we're going to dig into a deep and really, really important topic that is really actually very close and personal to my heart. Mother's Day was just the other day, and I know all of you probably had a great time with your moms, or if you're a mom yourself, you got to kick back and not wash no dishes and not cook anything and have a good time. But I want to talk to you about something that is really, really important in the Black community, specifically Black mothers and Black babies. As you know, I am a mom. My daughter is 24. My co-host, Dr. Nomsa Kalfani, also has a daughter, and she just turned 28. Happy birthday, Mayanna. And I want to really shout out all the moms watching, but we got to talk about something that's really, really, really important. We're going to talk about African American infant and maternal mortality. Many of you don't know this, but when I had my daughter 24 years ago, she was 8 weeks early and weighed 3 pounds, 11 ounces, literally a high risk category for infant mortality. This is something that is so very important to our community that I wanted to talk about. I'm going to ask my producer Kwame to put up a slide on infant mortality rates by race. And you will see how big the difference is in infant mortality rates here in Los Angeles County. Now, I want to just say this as well. This is not just a Los Angeles County issue. This issue is across the country, where we are seeing Black women of all income levels, educational levels, have higher infant mortality rates than other races. See that big difference? That top line is Black, African American, and everyone else is down below. Our rates are 2-3 times higher than everyone else's. Can you share that slide on maternal mortality, Kwame? This is for, again, Los Angeles County. This is maternal mortality, women that have died during childbirth. This graph is by what's called service planning area. LA County is really big, right? We have a lot of residents, 10 million. So we've carved the county out into 8 little smaller areas called service planning areas. That really big, long one in the middle is SPA 6. And if you know what SPA 6 is, you know that is South LA, Compton, Watts, Linwood, Paramount, the communities where the majority of Black people live here in the county. Those rates are high. We are in a crisis. And I don't know if everybody knows what's going on. So I wanted to talk about this today. Let's bring on my co-host, Dr. Nomsa Kalfani. Come on, Nomsa, we got to talk about this.
Hey, girl. Hey.
So I know, like I said earlier, we usually be giggling and laughing, but I think today is heavy. This is big, and I think that with Mother's Day just passing, you know, it really brought this home for me. When did you first learn or hear about African American infant and maternal mortality being an issue?
I would say probably 2004, 5, maybe 6. When I was working at the clinic. I used to work, as you know, to work at a community clinic for a while. And we also were funded by First 5 LA. They had a healthy birth initiatives to improve birth outcomes. And so I think that is where I really got to dig in deeper and better understand, because it's not a new issue. Unfortunately, it's an old issue, but I think it goes back to how we are seen, right? In terms of in the healthcare that we are both part of, right? You know, our concerns, our worries, our pains. aren't taken seriously, right? And so we know our bodies, and we know when we need some extra care. And I think because we're not seen and heard, we end up with these outcomes that actually can be prevented.
Yeah. And I think for me, the moment where it really hit me, there were two key moments, and I'll share really quickly before we bring on our first guest. The first was when I was working in South LA and we watched that documentary, Unnatural Causes, and they had that episode called When the Bough Breaks, and it talked about racism and the impacts of structural racism on the bodies of Black women and how it impacted their infants. And they didn't even really focus on maternal mortality in that episode. It was really focused solely on infant mortality. The second one was when Serena Williams almost died. I said, "Oh no, we done. This is bad." And I think those were the two instances. Even I can't even say that when I had my daughter early, I really fully understood. I knew it happened to me. Yeah. I just didn't understand the big picture of that. So let's go ahead and dig in. Let's bring on our first guest. I think she is an amazing woman and is going to speak to this issue. And Nomsa, you take the lead in definitely getting to the bottom of this with her about what is really happening in this community. Let's bring on our guest, Ajua Jones. Ajua began her career in public health back in the day with Department of Health Services as a student worker, just like I did back in the old school days. And back then she had some opportunity to work with Great Beginnings for Black Babies, and that really kind of set her on the path to where she is now, leading a lot of the work around African American infant and maternal mortality. Come on down, Miss Ajua Jones.
Well, hello, ladies. Thank you for having me. Thank you. Thank you. How's everybody this evening?
Doing well. It's so good to see you. You're all fabulous. I'm like, wait a minute, I need some curls now, y'all.
Baby, I tell you with some curls, hey, when it gets to be about spring, summer, we will pull out and make sure the curls are popping, getting a fresh new look, having a fresh new mindset. So that's what it's all about right now for me. I like how you said she started with the county back in the day. I was like, okay.
We have to admit we are that age now, Joe. We there.
yeah, we have to. As more and more millennials and Gen Z come into the building, I'm like, and I just have to let them know, hey, don't trip, because I get mistaken for being, especially in the millennial, realm, and not far from the Gen Z, according to these fellas, but I digress.
Oh, okay. All right. Well, I'm gonna get us back to what we came here to talk about. Let's turn this conversation around.
Yes, what about break?
And Ms. Jones, I'm so happy to have you on here. I know this is a passion of yours. You have been digging in deep for a long time. Tell us what's the reality? What's the real? Why is this happening? The history.
The reality really deals with what has happened to the descendants of the African slave here in America the last 400 years. And so that's really what our reality is based in. Like you mentioned in my bio, I started out in the work back in the 90s as the first community health worker and then perinatal health educator with Great Beginnings for Black Babies, which was the first Black infant health program in LA County. And back then we had a lot of focus on women getting into early prenatal care to prevent preterm birth and low birth weight babies. It is yet still the same. A lot of the focus then was about what we were going through then was the drug and alcohol era. And, we've dug in deep to that era. We've dug in deep to a lot of the traumas that were associated from over-criminalization, even of Black women at the time, drug and substance abuse, and, not being provided with the resources, allowing those things into our community that strongly impacted our community. Because we used to say back then, now we know what nobody, Black really going across international waters, at the time, bringing in certain, drugs and of that nature into our community. And we saw the difference in how white folks felt when the opioid addiction happened, right? Then it's, oh, we're going to roll out these programs and services. So similarly, but even worse is that Black women have been having this challenge since, really since we were brought here, because our whole reason for being brought here was chattel, to be slaves, to produce and reproduce in order for the masters to have enough, employed to be able to till their land, right? To be able to build and create here. And so for us, it was great that around the time we started doing this work to create a community action team, because I won't tell you that public health have not been doing this. Public health had been doing it. And I was even involved in the 2000s with the Black Infant Health Program with the current program coordinator, Yolanda Rogers-Jones, working with her doing contract management over, at the time, it was like 5 Black infant health programs. But as what we had seen, and you saw the numbers there, is that back then, we still had high rates, 10 to 12% in comparison to the white rate of, 5 or lesser. So we were already still then 2 to 3 times higher. We never have gotten to the 5%. We have not seen 5% in LA County for the Black infant mortality. And now we have maternal mortality as an issue that is even more. But what happened, Dr. Ferrer mentioned this, and researchers, social science researchers, and leaders across the nation, especially public health leaders, began to, and even politicians, I know New York did it as well, began to say, here we have a crisis. Black moms are dying at a high rate. And the leading cause of that is not all the things that women have been blamed for in times past, that we have the susceptibility to higher pain, levels of pain. We don't listen to providers. We're not adherent to protocols. That was never the issue, as much as it was the color of our skin. And as much as it is race, and racism basically is perpetuated against us based upon our race. And so this has been the systemic and structural racism that has impacted our health and created these inequities. I'm not talking about inequality, I'm talking about inequity. I'm talking about Black women going in and not being heard by providers. Even there was an article that was put out last year by CNN that said that Black infants fare worse in the care of a white doctor than they do in the care of a Black doctor, meaning they could die in the care of a white doctor over the care of a Black doctor. How could that be so in this time and season? What is the rationale or the reason? And so if this person has taken an oath to care for and provide services, what is the problem? And so there started to be more and more conversation around this work, around the issue that, again, this was a public health issue that had not been, I want to say probably properly addressed, right? And it was more so looked at as victim blaming and shaming instead of, a partnership and engagement around what is really the problem.
Yeah, absolutely. And I think it's really important that you brought up the topic that nobody really wants to talk about, racism, right? That it's not about the woman not going to prenatal care and she's doing this, she's drinking, she's smoking, she's being a bad mom to her unborn child. It's not any of that, because when the scientists and the epidemiologists and all those people with the numbers control for those factors, we still see the disparity. And it always brings me back to my example. I was a undergrad in college, and going to school and doing what I was supposed to do. And my baby was still born 8 weeks early. Now, was I stressed? Of course, because I was a single mother. I was dealing with childcare issues. I was dealing with issues with my daughter's father. There was all these other things happening to me. And that stress ultimately played a part in what happened. And so one of the things I think that I will say really quick before we can, carry on the conversation, that was really hurtful for me to understand was even women with higher educational attainment, with health insurance, that had all these other things going for them, still have worse health outcomes, birth outcomes than anybody else. A white woman with a high school education has better chance of having a full-term baby than a black woman with a college education. So the things that we consider protective factors actually do nothing to save us. And my question is, how do we talk to Black women in our communities? How do we talk to our sisters about these topics? Because they're so heavy, they're so layered, it almost sounds like you are doomed. What do we say?
So here's where I want to step back and I don't want to say correct you, but just point out some of the things that have, the generational trauma or the systemic trauma has caused us to even how we engage with one another. So one of the things you mentioned is that, because you were a single mom, you were stressed. I don't believe that we're particularly stressed because we're a single mom. We're stressed because how the system responds to single mothers, right? The system has, also broken our family models and structures. When we had, families that were together, if that spouse, most of the, and I'm not, Nomsa, this is your field. I don't do, family therapy or, any mental health work, but I got some good sense, and I've been around and done this work a long time. But we all know, and we hear most of the arguments in relationships have to do with money or they have to do with sex. So here's the issue. If a brother has no resources, and we can go back to the 60s, right? When, one, we were lied to. We didn't get our 40 acres and a mule, right? And if you go back and you look at what happened, even with the money that was supposed to be kept, like, instead of giving us the money, they're like, oh, you'll work and we'll put it into this bank. Then the white folks that were running that stole the money, tried to bring Frederick Douglass in after they had messed up and took all the money out the banking system so then he could repair and fix it. And all those people who had invested had lost. Not to mention, when we created towns of our own to be self-sufficient, you tear that apart. So then you have this system, and honestly, if we look back at slavery and we look how generational traumas have occurred, we weren't even supposed to be married in their eyes. We weren't even depicted as human. So how weird that is to me is this. A person is not human, right? But you are don't have the same rights as you. But how these same people, how white women allow Black women to nurse. You don't like me, but I can use my breast to nurse your children. I can get in the kitchen and cook you food, and you don't like me. You abuse and you mistreat me, but you don't like me, and I'm not human enough, but you'll eat from the hands that prepare. We are the people who have birthed and raised this nation in that sense. It was our children who were dying. Some of those sweat nurses, their children were being malnourished and not being served because they had to see Master and Mrs. children.
That's right.
Same thing applies with the relationship. Men were taken from house to house to house to house. They weren't supposed to settle in. They weren't supposed to get attached to their children. They had to act like they didn't even like their children. So a lot of times when we see all this trauma happening in our communities, on top of what we get to see from overcriminalization to continually violence from police violence against unarmed Black people, to hate and racism. I mean, just the other day, I saw 2 Black girls doing a blog, minding their own doggone business in the park. This is what baffles me. For minority people to come here and then be racist to the people who struggle for them to even get the rights and participate as white people have done to us is baffling to me. But the woman, she had an accent, so you knew she wasn't even probably born originally in America. Took the girl's charger, acted a fool, said she was, and the girl said, "You must be racist," and she said, "I am." They had to call the police over a charger, a phone charger. Why are you bothering them? Mind the business that pays you. This is the problem. And so this is the stuff that happens to us here in America, and it's like, those are stressors. Those are the unnecessary stressors that lead to what you're talking about. I'm sure at the time that you were pregnant and young in school, there were people looking at you crazy, because I was a teen mom too. And there were people that were in the business that did not even care for me. So going back to how do Black women support each other. We uplift when we see a sister that is pregnant. We do our best to support her and educate her, provide her with the information and resources. We don't have to get involved with whether she's single, whether she's with that man or not. If they have some type of healthy relationship, we should be promoting. If they don't, we should be getting them all the resources that they need for it to be a healthy union, because a lot of times our relationships don't last the lifespan of our children.
Right.
Not to mention, the other thing is the challenge for us here and the challenge for our elders were, I could birth a child that may not even survive as much as love and attention that I pour into them. Somebody, some insane, supposedly human being will go off not minding their business and harm my child.
Yeah.
Right. Yeah.
Yeah. So it's some that have taken oaths to do this work and they're still harmful. I mean, you'll have to have Jessica Wade on here and she'll tell you some of the NICU stuff, like a nurse tampering with breast milk. In the 2020-21 realm, because she didn't like what parents had to say about, the right to breastfeed and all of that stuff, or another woman who was in the NICU for 7 months with her baby. Now, if I'm coming to this place for 7 months and my baby is in your care, and show up and you say, well, you look too dark to have a baby that light. How is that your business? Are you here to provide health care and services? Is it your business to be in my business that has nothing to do with my health? You are creating more trauma and drama in my life. Mind your affairs. Yeah. And that's the sad part about it. A lot of times, is the affairs that people are supposed to be minding, they do not. And that has to do with the structural health. If I come up and I share with you that something is going on in my body, this is my body. I get to feel it. You don't get to tell me that I'm imagining the pain. The pain is not existent. I don't need that. Treating me like, I have a friend who just had a major surgery. And she was like, the doctor he just put a general, but he didn't put this other, whatever the anesthesia was. So she woke up in all this pain. And they were like, well, you don't need this. You don't need that. Excuse me. Do not treat me like I'm addicted.
Right. Right.
Give me my pain meds.
Right. So let me ask you this. With all of this, we're talking about what's happening in LA County. What is LA County you talked about having resources. What is LA County doing to respond?
Well, thankfully, you sisters have been a part of the network and have supported our work. So I really appreciate it. But what was happening for me in about 2017 when I came on the whole person care, and prior to that, when I was in graduate school and before I had taken my break because I didn't, I was like not ready to finish my thesis, I had a mindset to work this thesis around Black infant health and government partnership and community, and how was that impacted? How are we working together to solve or address Black infant health? And I wanted to look at Florida in comparison to LA County. But then I got into this program, into this workspace with whole person care with DHS. And that one of our goals was to identify gaps in services and resources and to create a community action team or partner in with one that was already doing the work to help build up the capacity and infrastructure of nonprofit organizations or grassroots organizations, community-based orgs that were already doing the work. And so I started coming to some of you all, some of my colleagues I have worked with for years and said, hey, listen, if we start this community action team, would you participate? Would you be interested? Do you think it will make sense? Prior to that, Jan and they were a part of the Black Mamas Matter Alliance, and they were starting the Black Maternal Health Week. So we started coming together to have some of these events, meeting with my cohort was Diamond Lee for SPY 8. Then we had some of the DHS staff that whole person care had funded their positions, like Nancy Rodriguez and Leslie Lopez. I reached out to Yolanda. All these folks that they were having some smaller meetings, but I said, our community needs to get involved. And we must partner with the community because the community is not fully aware, but more so the community knows what it needs. We can't always come in dictating how to serve the people most impacted and saying, Well, they don't show up. Listen, when we started this, I went into the historical, I get into this. But I said, hey, listen, if I go over to, I don't want to even blow up anybody's restaurant right now, just wherever. I could go to Macy's, I can go to Nordstrom, I can go wherever. If I go someplace and I am not treated right,
yeah,
and I'm spending my money and my time, rest assured I ain't going back. And on top of
Absolutely.
not going back, I am not going to tell others about you in a good light. I'm going to share
yeah.
my abuse and my mistreatment in your facility. So here's the thing that I feel like, and I started to talk about this, I feel like healthcare practitioners, clinicians, we're so busy doing this work, healthcare professionals, that we forget the human part of it until we are sitting there laid bare.
Yeah.
It is I've exposed my whole world to you, because now I've laid bare on this table, right? This exam table. And you are now able to examine my whole body. I'm trusting you to do what you know to do. But if you won't hear me, and as I'm trying to tell you what I feel and what's going on with me, why would I continue to come back to you? And some people go back because they don't know that there are other options. And that is what we're doing. We brought folks together, nurses, midwives, doulas, clinicians, fathers, grandfathers, grandmothers, prayer warriors, our whole community, faith-based organizations, all the grassroots organizations, anybody who wanted to hear, come and let's talk about why Black moms and babies are dying. 4,000 Black babies, CDC reports, we lose annually here in this nation. There are 50,000 near preventable deaths. So there's a risk, a maternal death risk, 50,000 near. When you talked about Black women and the issue here, they put it this way, and how it crosses our socioeconomic and educational factors. Black women are at risk of dying at 243% of pregnancy-related complications here in America. 72% or 71% for cervical cancer. 20-something% for heart disease. Let's go back. I said 243% more likely to die from pregnancy-related complications when it's preventable. Finally, the CDC having all this information, only last year they created their Hear Her campaign, mostly centered around Black women and their need, but it really encompasses all women. Hear her. And if we improve, everybody improves. Sadly, not every structure thinks like that.
Yeah, absolutely. You know, Ajua, you've given us so much great information. As we wrap up your segment, can you talk and tell the audience, if they want to help, if they want to get involved, how do they reach you? Email, website, share how they can get in touch with you, because I think that there are going to be a lot of people that are going to want to help.
Certainly. So this is I got 24 hours left with the Department of Health Services, and I will be going back to the Department of Public Health with maternal, child, and adolescent health programs. I actually do not have my email address as of yet, or a new phone. I can say folks can definitely, I don't mind sharing my my other email, which is adjjones.381@gmail.com. The other way to really reach out and learn about our work is the Black Infants and Families Los Angeles website. So it's www.blackinfantsandfamilies.org. Then also they can reach out, and did I say .org? Let me check that out while I'm talking to you. They can also follow us on Facebook. We have a Facebook page called Black Infants and Families Los Angeles.
Mm-hmm.
And then we have Twitter, BIF_LA. Then we also have a Instagram page. So there's so many places you can find us, and you can say, hey, I want to get connected to the community action teams. You can join the work groups there. You can get involved. We're looking for mothers, fathers. Also, right now it's on pause, which means they have met their current numbers, which is great. But one of the things we really want to do is we want to push for doula services to be provided as if you're interested through your healthcare provider, right? So the department has a free doula services for African American women in LA County, but the push is for Medi-Cal to cover for all pregnant women, no matter what race they are, and to see if we can get our health plans, other health plans that we pay into, to do that as well. So SB 65, look it up. Senate Bill 65. It is the California Omnibus Act. We know you look. Essential Health Access has been a supporter. Thankfully, our illustrious second district supervisor, Holly J. Mitchell, put forth a board motion, and all of the supervisors unanimously agreed and voted to support that SB 65. And there's been some other support that they have been doing around this work for us. Supervisor Hilda Solis, definitely our former supervisor, Mark Ridley Thomas, and all of them, Sheila Kuehl, Supervisor Barger, and I don't think, and yeah, I said Kuehl and Barger. Okay, didn't leave anybody out. I want to make sure I don't leave nobody out. Don't penalize me if I do. Try to keep my head and not my heart. So yeah, that's how you can get involved, ladies. So thank you so much for having me. I appreciate it.
Thank you.
Yeah, it was my pleasure.
All right, and make sure you put all that information in the comment section of the live so people can access it, and we'll make sure it gets in there. Thank you, Ajoa. We are going to go ahead and head into our commercial break. Take it away, Kwame. And we're back, and Nomsa is doing something else. I don't know what she's doing.
I need to plug in my computer.
Girl, you got to learn how to move quick between the commercial breaks. We are back, and I would just say before we move into our part 2 that I love Kwame. Kwame is such a professional. Pyro Media is amazing. They put all this stuff together, and if you are interested and you feel like you are a social media maven or maverick or whatever you call that in your heart, and you need that help with your media, you need to reach out to Pyro Media for that, because they are amazing and will take care of you. Very professional, but you got to bring the magic, the personality in, but they gonna take that and just amplify, just above and beyond. So
clearly I need some more lessons.
I'm like, girl, you got to move quick between the commercial. Lord, where'd she go? I'm so glad we had Ajoa on. She really gave us some good education and a good foundation about what's really happening and what's going on. Now we have another guest coming on. Milan Spencer, who I have known forever and ever, colleagues at our workspace, and she's just an amazing woman. I love her spirit. She just has this spirit about her, just so kind and sweet. And it's funny because she's probably mean in the back, on the side. I'm just kidding. But she's just such a beautiful person. Like, how you can feel it coming off of somebody, just this beauty and this just wonderful person. So going to bring her on. She works with me. We've worked together for about 14 years. She currently is a health program analyst at the place where we work. She has an extensive passion and expertise in breastfeeding as a certified lactation educator and is a certified childbirth doula. So let's bring on Milan Spencer.
Yay.
That was
Hey,
it. Hopefully you all stepped away.
Nicole. Dr. Connie, thank you for having me, Nicole. I am the same way in the background as well. I'm not me. I'm asleep.
Now, I
Thank you
forgot
so
to
much for
mention
having
something
me.
very important about you. You are a mother of 3 beautiful children. You have a son, you have a daughter, Mia, and you have another daughter, Logan. And I'm
Yeah.
tripping off the fact that you said that Logan is almost a year old. And I was like, but I remember when Mia was like little, like, what tell
That's
me
when
slow
flies.
down.
Yeah, my little one, she's turning 1 next week, next Friday. So
Oh, Lord.
it's been crazy. She is my pandemic baby, and it's been nuts, but it's been good. It's been good.
It's a lot of pandemic babies coming around. I just checked in with my coworker. We were on a Zoom call with him one day, and matter of fact, it was me and Markeisha and him. And Markeisha said, "I hear a baby," and he was like, "Yeah, my fiance had a baby." In February, you had a whole baby.
The COVID babies, they just kind of pop up because, no one ever sees them unless we get on a call or a Zoom. They're stuck in the house. They don't know about strangers. They're like, what?
He was like, yeah. He was like, we've been here at home this whole time. And I was like, say no more, sir. Say no more.
When these babies grow up, it's going to be really interesting how they socialize. So, yeah.
Right?
My daughter, my 1-year-old, is just now warming up to other people that are not in our household.
Wow, that is going to be interesting. Now, I don't know how much you heard of Joa's conversation, but and I know you know the story. You, of course, have birthed 3 children. Nomsa and I are brothers as well, and I know we're very familiar. We work in public health. We know the story. But I mean, just can you share your thoughts and feelings about this whole issue of African American infant and maternal mortality and these really, really high rates, this disparity? I think the disparity is worse than even the high rates. Like, it's just the difference is so stark. Just want to hear your thoughts.
Yeah, I work very closely with Adjoa on our AIM initiative in LA County. And, she laid it out really, really well for everybody to understand the critical importance of us addressing this issue. It's literally life and death, which is a really sad thing to say, but it's the truth. And for me, it hits close to home for a number of reasons. And I think, Nicole, you can relate to this. We're in this work and we do this work day to day, but we are also the people that we're talking about. When we look at data, like that's our lives. We're not just numbers. We know, like, if it doesn't hit you personally in your own home, you know somebody that it has affected. And to that point, when I was pregnant with Mia, who is, she's 3 right now, my middle child, my cousin and I were pregnant at the exact same time. And her daughter, Skylar, was born with some medical issues and did not make it. She lived, I want to say, for about 6 months or close to 6 months, and she passed away. And she's like our angel baby now, but it really hits home that this is happening to us at an alarming rate and we have to do something about it. And so for me, having another baby after that, and then the pandemic broke out, it was very frightening because going into a hospital as a Black person, not pregnant in any way, it's a risk when you go in, right? It's a risk factor. But then you add in a pregnancy and then you add in a pandemic on top of that. I was terrified. And then I was terrified of being terrified. So I'm like, I'm creating more stress for myself. And I'm already at risk because I'm a Black woman in this country. So it was just so many layers that I had to deal with as a pregnant mom last year. And so it really hit close to home. And although, you know, the numbers, like we see the numbers, we see the data, we know what's happening, I'm really encouraged by what's happening and what's going on in terms of addressing this disparity. I'm really encouraged by what LA County is doing. I'm really encouraged by what other states are doing. It is really becoming the hot emerging public health issue all over this country. And so that gives me encouragement.
Absolutely. And you said something that I actually write about in my book, Pushing Through, Finding the Light in Every Lesson. Just gotta, you know, put it there.
Yes.
I literally remember the day, I don't know if you were in that email, I can't remember, but that day I went to that racial equity training and was really like, what am I watching? What am I looking at? And Tiffany said, the problem is that when they see numbers, we see faces. And that is exactly what you just said. And what I feel like a lot of us, and I know Nomsa, you're probably in that number too, are in the work that you're in because there is some personal connection, there is some drive and some need to want to help the community because we are acutely aware of what's happening. So just thank you for kind of saying that, because I don't want to be the only one talking like that. Like, yeah. I know I ain't the one that understands.
It's real.
So we have some,
it's like you're trying to save lives and you're trying to save your own life
at the same time.
Right. Yeah. So I'm gonna jump in. You know, Jo, as she was leaving, ending her session, she brought up doulas.
Yes.
And a lot of people don't even know what a doula is. It's like, you know, what is a doula? What do they do? Why are they important? What's the added value of having a doula, especially with think of the reality of what we've been talking about. Yeah. Talk to folks about what doulas do when they're valued.
Yeah, so a doula, I love to say that a doula is a love servant. I call it a love servant. Doula actually derives from a Greek word, and it means servant, servitude. So when we talk about childbirth, being a childbirth doula, you're a support person. You're a support person for the mom, the birthing person, and their family. You can provide support under 4 different pillars. One being physical support. So we do offer pain management techniques. We do offer a lot of physical touch that can help bring a baby forward into this world without causing as much pain. We do offer emotional support. So we're concerned with the mind, body, and spirit of the person that is giving birth. We are not just concerned with healthy baby. We are concerned with healthy baby and healthy mother, because that is critical. We also offer support, informational support. So we're health educators. And I think, you know, Nicole, you can appreciate that, because that is where, you know, we started out in this public health game as health educators. And doulas are really great at being health educators and informational support people. And then the last one is advocacy. And advocacy is extremely important. I know Adjoa laid out a lot of the things that are going on and what we're up against. But I want to highlight two ways that doulas provide a buffer. When we're looking at this disparity and what's going on with Black women and Black babies, it's twofold. So we're in a system that is racist, okay? So we're dealing with a racist system that causes us stress in our bodies. And that stress in our bodies is a risk factor when we become pregnant, because we have that stress, our babies and ourselves are at risk, right? So that's one side of it. The other side is, because of that structure in that system, we are also dealing with people who are overtly racist, have biases. And when we access care, we're dealing with those elements. So it's 2 things. We're dealing with people who may have biases about us, and then they're also charged with treating us and giving us health care and basically our survival when we go into a hospital. Our life is in their hands. And then we're also dealing with the stress that has built up in our bodies just being Black in this country. So for doulas, offering that physical support, that emotional support, that informational support, And then lastly, that advocacy. We cover all the bases and we act as a buffer for a harsh system that often times is not very kind to us.
Yeah.
So I think it's super important for any woman who wants a doula to have a doula, but it is especially important for Black families and Black women to have a doula. We are not medical professionals. We are not there to overstep the doctors. We're not there to overstep the medical professionals. We don't deliver babies, but we are there in support of the mom. We're there to help her find her voice. It's not my voice, it's her voice. I think we've all experienced labor here. We know how difficult it can be to convey the things that we want and need when we are in pain and when we are experiencing contractions. So a doula is there to help that person find their voice, help them remember, this is what we talked about. This is what you said you wanted. This is the experience you said you wanted to have during your labor and delivery. And we are there to explain what is going on in the room with doctors and nurses. Like there's a certain thing called health literacy. And no matter how much education you have, if something, if you're diagnosed with some type of cancer today and you're not really well versed on that cancer, you have a very low health literacy when it comes to that topic. And so we bridge the gap between the medical professionals and the laboring, birthing person, the mom. And I think it's an incredible thing. Right now, LA County, they have the AIM Doula Project, the AIM Doula Initiative for Black families. So if you're a Black family, Black mom, Black person giving birth in LA County right now, it is very easy to get a doula. And I would say definitely do that. Because especially with this pandemic, I gave birth last year. I'm a doula and I had a doula. And it really helped alleviate a lot of the fears that I felt going in. I was panicked about a lot of things. I was panicked about getting COVID. I was panicked about about my husband getting COVID. I was panicked about maybe having to have a C-section, and then I would have been totally alone because hospitals were on lockdown. And I think it's the most dangerous thing for a Black person to go into a hospital or a hospital setting for any type of procedure and be alone. That's the reality of the situation. It's especially dangerous for Black women who are birthing to go into a hospital alone. I'm gonna keep it on 100.
And that's so sad to hear. Again, I think it just speaks to the differences and how we have to navigate the systems in society. And I talk to my students about this a lot. Like, the way that this all plays out is that my experience navigating the systems in society is very different from yours. Your expectation is that those systems work for you and will benefit you. And when you are talking to people in those systems, you are believed, you are understood, you are validated. That does not happen for us. We go into the hospital, like I said, when Serena Williams got as much money as she has, like hello, and was disregarded, just like any other Black woman. So it's like, what in the world? And it really feels bad to know that ultimately we are treated differently, regardless. It's like how much money you have, and I'm really glad to hear about what the doulas offer. And I wish I had one when I was 18. I didn't know what the hell was going on. I didn't have Lamaze. I didn't have I had prenatal care, but I didn't have any of that because she was born so early. When I got to the hospital, they were like, honey, you are fully dilated. You are having her today. And I was like, but she not due till May.
Wait a minute, You would have really
benefited because I was freaked out.
Also could have benefited from a postpartum doula. That's a thing as well. Where a doula will come in the postpartum and make sure that mom, that postpartum depression, we're at great risk for that. We get all the things, and a postpartum doula can help with that. Mommies who are in the NICU, because our babies tend to go in the NICU at a higher rate, They need support. And I think right now people are starting to understand the importance and the values and the value of doulas more than ever before. And that gives me hope, because when I came on, I said it's life or death. So if you think about it, if Black women are dying and our Black babies are dying, what implication does that have on our existence in this country, right? It's critical.
Right.
So it's important that we address this, and I'm so happy to see so many things coming to fruition to help. I call it a buffer. I call it a buffer because it's going to take some time to change a system. So we need buffers in place, right? We need doulas. We need Black families to start understanding how they can birth in different ways. Birthing centers, a home birth.
Right.
I really think that as long as we continue to educate Black families, Black mothers who are delivering, that they do have options. They have options. And having a doula decreases the need for medical interventions during labor by up to 25% and sometimes up to 30%. And that's huge, because if you think about it, when we're going in to deliver, a doula is helping you have that labor and delivery experience that your body is meant to, right? So a doula can provide pain management support, so that you don't feel like, oh, I absolutely have to have an epidural, which comes with a whole nother set of risks, right? A doula can help. You do certain techniques to make sure the baby comes down, the canal turns the baby a certain way, to make sure that your labor does progress in a natural way, so that you don't have to have an emergency C-section, which creates another level of risk, right? So we're looking at all these different stages where a doula can be super effective and helpful to having a positive birth outcome for mom and baby. Because just having, it's wonderful for us to have healthy babies, but we want healthy moms too. And I've known many women, myself included, who have had healthy babies who have also had very horrible birthing experiences tied to that. So we're trying to concern ourselves with the whole, even the family, the partner that's there. I am not there to overstep partner boundaries. I am there to empower. And I am there to empower a partner. As if I can do my job and stand in the corner while the partner is hands-on and understands what needs to happen, then that's great. And I think we're seeing an uptick in partners being engaged, and families understanding that they have choices for their births. And I'm really hoping that eventually we'll get to a place where society as a whole sees doulas as an effective and critical part of a labor and delivery health team.
Wow.
I love
amazing. Nomsa, do you have any questions or further?
I'm just like, I think we should let people know where in LA County, or what's the website, or where do they go to find out to get their doula?
Yes. So right now, blackinfantsandfamilies.org is the AIM Doula Initiative. You can get information from Black Infants and Families LosAngeles.org or their Facebook page. I am on Umi Doula Los Angeles on Instagram, UMI Doula Los Angeles. You can message me directly. You can contact me at milanspencer616@gmail.com. And I know right now, I think our AIM doulas, our Black doulas in LA County, they have reached a certain quota for the next couple of months for births. But if you reach out to me and you are in need, either myself or I can put you in contact with a doula who is willing to serve pro bono. So there's resources out there. So definitely, if you know someone, if you are that someone, if you know a family that is in need, they are going to be delivering a baby, please reach out to us, because we want to make sure that our village is taken care of. And I think that it's really critical right now to ensure that our babies are coming here healthy and our moms are remaining healthy, whether they go to the hospital, or birthing center, or at home.
Love it.
Absolutely.
Love it. Thank you.
I'm over here like I need a do-over. I'm like, can we go back? Because I need a doula. Do I need
Doesn't
to
it
get
make you want to do it
pregnant?
again? Well, without the pain, but yeah.
I'm like, I can still have children. Maybe I should have another one. Just do it. Just do it. Do over.
Do it, Nicole. I can be your doula.
Girl, I am not getting. I would be so sad. Like, oh, I did that. I'd be like, I'll let my daughter raise her. Here, Andrea, he's your sister. You can raise her.
It's over. It's over for me too. I'm done. But you know, I'm grateful that I get to support other families.
Yeah.
during delivery.
Yes. Well, thank you, Milan. It was such a pleasure, and especially for me to hear the other stuff that you're doing, right? I know you as, a coworker, colleague, but to hear the other things that you're passionate about and doing, it's like, wow. So next time I see someone pregnant, I'm like, let me give her.
Yes. Thank you so much, you guys, for having me. It was an honor to be here. Doc Kalfani, my soror, I see the open Thank you, Nicole. You know, we go all the way back. So I continue to tell you, and I'm gonna tell you again today, I'm so proud of you. I'm so proud of the moves you're making, your book, this live. I'm so just impressed with the woman that you are, and I look up to you in so many different ways, and I appreciate you both so much.
Thank you so much. It was so much fun. Thank you for being here. We're gonna go ahead and wrap it on up. This was a great conversation, and I think I learned some more things. I'm sure you learned some. What's the takeaway for you, Nomsa, Dr. Kalfani?
Well, I think my shirt. Let me see if I can get my shirt to pull the thing. So you can see my shirt. Black women deserve better. Period. So that's the takeaway, right? We deserve better. We deserve to be seen. We deserve to be heard. We deserve to be respected. That's the takeaway.
Yeah, I agree. And I just hope we can get this thing resolved and have a better health outcome for our babies and our mothers, because this is just I can't even think of the word. Disrespectful, I guess, is one of them. But there's so many things that I can think of, like, why is this happening and why is it allowed to happen? But then again, I think about all the other things that are allowed to happen to Black people, and I don't know why I'm surprised, but I am. But yeah, thank you for joining me in this conversation tonight.
No, of course. I mean, and I think it's just a reminder that these systems were not created for us. And so with that, we have to dismantle what's in place so that we can get what we need.
Boom. And on that note, let's wrap it on up. Thank you all for watching tonight on Nicole D. Vick Live. Feel free to catch me next month. I do these once a month. In the meantime, if you just really want to see what I'm doing and what's going on with me, you can follow me on my Instagram, Nicole D. Vick, my Facebook, Nicole D. Vick. Check out my website, www.NicoleDVick. My book, Pushing Through, Finding the Light in Every Lesson, is out. It is available on many platforms: Amazon, Barnes & Noble, Walmart, Malik Books here in Culver City, Issa One Book website. It's everywhere. Just look it up and you'll find it. And we will see you all next time. Thank you, Kwame, for always doing a fabulous job. Thank you, Dr. Kalfani, for being my co-host. We will see you all next month. Bye, everybody.
Bye-bye.